everyone. Thanks so much for coming on this kind of blustery day. But I did say to my daughter this morning, it could be snowing right now, and it's not. So the rain is actually quite lovely, even if it is a bit early. Thanks for being here. My name is Katrina Mullaney. I'm the acting scientific director for the O'Brien Institute. And I am very excited about today's discussion. This is actually part two of a discussion around research to impact. And I think this is just a fantastic conversation that's happening on multiple levels at the university right now in terms of why, for me, it's why are we all here? I believe that we are all here because we have opportunities and ways to leverage really good science, really research in ways that can actually make a difference in the world. And so typically as academics, as many of you know, we are measured on things like our publications and our grant funding and the students that we supervise and presentations and all of that. And all of that is great. It's great for impact for a particular audience, which is people like us. And I think what I'm excited to hear about today is what are the ways in which some of our researchers and some of our folks here at UCalgary are utilizing research in other ways besides for other researchers. So I'm very excited to introduce our panel today. This is a very casual conversation. Really hope that you'll come forward with some good questions. We have quite a few people online as well. So our lovely team of Brittany and Mariko will help manage the questions, but please do bring your question forward because we have a fantastic opportunity with a fantastic panel. And so I will briefly introduce our panelists. We'll ask them to introduce themselves a little bit more and talk a little bit, 5 to 7 minutes each, about their research to impact work. And then we'll do a Q&A. So hopefully that sounds like a good plan and what you were expecting. And if it's not, please raise your hand and say, Katrina, that's not why we're here. We want to talk about something else. And anyway, we're not going to do that. So I'll just briefly introduce, to my left, we have Erin Johnson, and Erin is going to talk about policy as an opportunity to increase impact. We have Stephanie Warner from the knowledge engagement team, and knowledge engagement to research impact, which is a lot of community engagement type work. One of my favorite people next to her is Caitlin Stolfus, and Caitlin is one of our PhD students. Caitlin has a background in social work and is now doing her PhD in community rehab disability studies. And she's going to talk about some fantastic work she's doing with a community organization called SafeLink as part of her PhD research. And then finally, one of my other favorite people, Gabe Favreau, who is going to talk about research and media engagement. So if you follow You Today and the people that are cited in the media all the time, Gabe is often one of them. And so I'm really excited that we have multiple perspectives here to share around research to impact. So are you okay to start, Erin? If we just start. So please go ahead and introduce yourself and there we go.
Thank you. So my name is Aaron Johnston. I'm the Associate Dean for Distributed Learning and Rural Initiatives here at the Cummings School of Medicine. I'm going to talk about using policy work to increase impact. I'm not coming at this from I'm not a policy expert. I'll talk a little bit about that. But I don't think you have to be a policy expert to think about how you can leverage and inform policy based on what you are an expert in. So my area of expertise is really around sort of rural education, rural health workforce, and a little bit about rural health systems. And that's where I spend most of my time, my research time, but also it's where I spend all my administrative time. And so when we're talking about research, I also wanted to think about not just maybe the capital R big research that you do that's a research project that involves a grant and a bunch of publications, but sometimes maybe the programs you administer or run and the data you collect around them and how you become an informed person relating to that area of expertise. So last spring, before the election, some lovely folks at the O'Brien Institute approached me about doing some policy work around a paper that we call Priorities to Improve Rural Alberta. And initially I said, like, I'm not a policy expert, I kind of don't know how to do that, but luckily there was great support from the O'Brien and people who were experts to guide us. And we created an amazing document that didn't really require us to develop a different expertise, but did require us to engage with policy experts and to shift the lens a little bit, to change this to be more for a public audience, more for a government audience, to take the work that we've done, you know, the things we publish for each other, the same as we all do that, and change it to a general audience and get it out there to start a discussion. And that was really exciting to do. It was really fun to write. It was a different writing style than I'm used to, which also was really fun. So it was fun to think about that, like a different audience reading it. And it really did, I think, leverage sort of the areas that are important to me and my co-authors in this project in terms of impact. So we got lots of interest in this. We did a couple of community events. We ran an event in Pincher Creek, which was a great sort of collaborative opportunity between my office, my rural office, and the O'Brien to get outside of the city and engage the public. And we had a standing room only audience in a church in Pincher Creek that we had a hard time stopping at the end of our hour and a half of running. So people were really engaged with the work, which is really exciting. Had a number of MLAs before the election come and meet with me and want to talk about this work specifically. And so it was a great opportunity to bring people in to say, oh, hey, this is going on out there. And I want to talk to, I'm a decision maker, or I'm a community member who's invested in this, and it's important for me to be able to engage on this. It allowed us to highlight a couple of things. So like one of the important things to me in this rural work is that rural is often framed as a community of deficit. And I think that's not always true. There are challenges in rural, but there are also bright spots. And so I was able to incorporate that lens into the policy work we did, just to talk about not only like where are the problems, but where are the solutions. And so that was a really cool thing to do, because I think it's a framing that sometimes people who live mostly urban lives don't necessarily think of, that there is solutions out there in rural that might apply not only to rural, but to other systems as well, like urban systems. So for me, it was a great experience. It was Chuck. The work that is really important to me and is core to the work that I do in a different direction, allowed me to engage with a really different audience than I usually would. And I think it had some impact. It caused lots of people to talk anyways. And it was fun. And so I think this is a policy expert crowd is what I'm reading into my overview of the room. But I think maybe as experts, supporting non-experts to leverage things that they're knowledgeable about and to think about it. Like, have you ever thought about this from a policy angle and what would that look like? I think actually can be a really cool exercise and can really broaden the work we do. Not just like the people who are really connected with the O'Brien, but people maybe who are less connected, but you see as doing work that's adjacent.
Thank you very much. Before we move on, Gabe, did you say you have to leave early?
No.
No, okay, sorry, I heard that incorrectly. All right, should we just move down the table then?
Yeah, sure. Hi, everyone. I'm Stephanie Warner. I'm the manager of the Knowledge Engagement Unit. We're a unit in research services, and we support a number of different functions related to research impact. So I wanted to kind of start with saying a bit of a caveat. I work in this really social science, community engaged space right now, but I'm actually a bench scientist by training. My undergrad's in biochemistry and my PhD was in more cell biology, and I came here as a postdoc in the Snyder Institute. So if you'd asked me a number of years ago about, impact or knowledge translation, I would have said something like it was about translating research knowledge to non-experts, some sort of like amorphous mass of non-scientists. And I think especially in the last couple of years, my understanding's evolved quite a lot in this space, and I wanted to share some of that with you today. So how many of you here have heard of knowledge engagement before? Oh, quite a few. Okay, how many of you have like worked or actually engaged with knowledge engagement? Great, okay, wonderful. I look forward to meeting you. I've been with the team since November of 2021, so I think I'm still kind of getting to know folks in a lot of these spaces. So knowledge engagement is actually a term that was developed here in Calgary. And I'm going to read the definition to you because I think it involves a lot of really interesting keywords that frame kind of what we do. So knowledge engagement is defined as a dynamic and reciprocal process in which multiple parties come together to address mutually identified problems. So you're seeing a lot of that engagement aspect in relationships as well. And the purpose of this deliberate engagement is for the co-creation, synthesis, and application of knowledge and evidence to benefit the community at large. So to me, that's like research impact written all over that. there's also, instead of just kind of translating knowledge, there's that aspect of connecting with community. So I think in plain language, you could define that as connecting with the right people at the right time in the right way, so that the research knowledge is useful, usable, and used. So I think there's this aspect of, you know, how are we building those relationships? And this is really about maximizing the impact of research. So now I tend to describe our team not as that full definition, but all things related to research impact. So we support researchers to connect with community partners. We have a partnership matchmaking service, mainly in the social sciences, humanities, community health type spaces, which may have been how some of you have engaged with us. We also support knowledge mobilization, planning, and strategy. So researchers who want to build a plan to get their research knowledge out into the community and to really think more deeply and broadly about the impact they'd like to have. A couple of other avenues that we're adding in that I think are relevant to this part of the conversation is that our team is supporting the University of Calgary's commitment to DORA, the Declaration on Research Assessment. I'm seeing some nods, some confused faces, but DORA is really a commitment to, when we assess researchers, to consider things beyond just publications, to consider broader types of research outputs and broader impacts on society. And our team is also in the process of adding another position related to open science strategy. So how data can be shared, infrastructure can be more open, how we can be open to more knowledge systems. So really it's a pretty broad team. So to kind of bound it a little bit, I'll focus a bit on kind of that research impact piece. I was saying earlier, I never prepare remarks, so this feels slightly more cohesive than I usually go off in my tangent directions. I think a lot of us went into research or go into research to have an impact. And we have this goal of kind of solving problems for the benefit of others, whether that's the environment, society, the economy, patients, however it might be. In a lot of cases, the research cycle ends up being, I have an idea based on what's in the literature, I design a project, get some funding, I conduct that project, I write a paper, and that gives me ideas for the next cycle of grants and projects and papers. And we often stop at a primary research output, which is typically a publication. And because this panel is called Beyond Publication, I think it's really important to note that if a paper is published in the woods and no one is there to read it, it doesn't really have an impact. And I think that's the question that we're really kind of dealing with here is, if we didn't engage with the people that we're hoping to benefit, how likely is it to be taken up and to actually make that difference? And I think really that's where knowledge engagement starts to be a way of thinking and approaching research that's a bit, it's just a bit more thoughtful and other focused as well. So we could think of additional research outputs that could be useful, like data sets and protocols that can be shared by others, used in new ways. That might be a way of having impact. Maybe that leads to more openness and decreases research waste. We might also consider what type of output is most useful to the communities that we're trying to reach. And I think this is where the knowledge engagement team and talking about knowledge mobilization becomes really, really key. It's how do we know who our audiences are? How broadly have we thought about who might be impacted by this research, who might be interested in it, and how are we involving them in that process? We definitely promote the idea of engaging partners much earlier in the process, not when you're at the study recruitment phase, but even in the idea of how do we develop questions that matter to community and build them into the process of designing that research project and conducting the research project. But really, even when it comes to outputs, maybe there's research outputs that are more accessible to different folks. Maybe the impact we're trying to have is on policy. Maybe it's about a community report. So we're returning back to community to say, here's what we found, and we'd love to hear from you about how this could be applied. Maybe it's an infographic or a short video, but really it's that thinking about what is useful to those who might be affected by it. We can also, even at the level of an output, think about, how is that being used? Like, what are the outcomes from that? Is it taken up into policy? Does it change a practice or lead to even a patent if you're in kind of more the kind of intellectual property space? So those are often called outcomes, and that's like the next stage beyond outputs. And impact, research impact often goes even further. SSHRC, the Social Sciences and Humanities Research Council, defines impact as long-term changes to thinking or behavior. So that does get a little bit messier to measure or to assess. but really true impact can come up in surprising places. It can take a lot of time to occur. So really what knowledge engagement is focusing on is not just the assessment of research impact, but that's important. There's lots of models and frameworks for that. And if you're not measuring it, how do you know it's had an impact? Does it really count, I guess? But I think what I would say is more important is thinking about impact at all stages of the project and really building it into how you plan your project. And create conditions where impact is more likely to occur. So if that is through connections with community and understanding what the needs are, if you can build that in earlier, you're much more likely to work towards that impact space. So I think I'll kind of wrap up there. But I just coming back to that definition of knowledge engagement, like we really focus on building capacity to think about reciprocity, mutual benefit, engaging partners in a more meaningful way, rather than at that stage of kind of disseminating research. So what else beyond publications can we be thinking about? If there's any questions about that, we can do that in the Q&A, or if you'd like to engage afterwards, please reach out to us. But I'm kind of bringing that more esoteric framework into the space.
Thank you, Stephanie. And that is a perfect segue. That's gonna talk about, which is exactly that.
Hi, everyone. I'm Caitlin. I'm a second-year PhD student in the Community Health Sciences program, and I've had the privilege of working under the supervision of Dr. Katrina Mullaney. I feel I'm not a very good public speaker, and I hate feeling observed. So
So don't get
stepping
there.
out of my comfort zone here. Yeah, I'll look down. Well, I'll be reading, so I apologize in advance. But yes, thank you all for listening to me. So I'm currently studying critical disability theory as a way to sort of better understand the drug toxicity crisis. And so I contend that the critical disability is a transdisciplinary thought space because the disability identity category is very tightly connected to other categories of otherness, of difference, and experiences of marginalization. So extending this sort of theoretical lens to the drug toxicity crisis, we can see a direct line of sight that exists between normative standards of health and well-being and the political, social, and historical context that underpin it all. And also the difficult conversations that we need to be having because we need to be better at challenging our dominant knowledge claims about what it means to be healthy, especially from a harm reduction perspective. And so I had the privilege of working for a small community-based organization called SafeLink Alberta between 2018, after I finished. I'm a social worker by training, so after I graduated from UC, I started working with they were formerly called HIV Community Link. And during my time there, I worked as a data and evaluation specialist, but I'm going off script already, but part of my role involved, collecting data, analyzing data, and being able to roll that, client outputs and outcomes to government funders or whoever it may be, in order to prove that, our funding to impact kind of linear continuum of care. And I was just getting so frustrated in my time there because I couldn't access any of the most relevant and up-to-date literature because of all the knowledge gatekeeping, the paywalls, and it was just really frustrating to be able to try and complete grant applications without the most up-to-date literature. And then Katrina swoops in and she was doing some contract work and I was able to have a meaningful conversation with her. And then 2 years later, here I am. And so part of my project is really engaging with SafeLink in a meaningful and authentic way. And so right from the get-go, they have been project partners because and once again, Katrina once said, you have to move at the speed of trust. And so it's taken 4 years to develop an authentic partnership and community-based relationship with the amazing, not only the staff, but also the clients who work there. And I'm still anchored there in a professional and personal context. So why should we care about the impacts beyond publication? I actually invited some staff members into a conversation. I canvassed them and gleaned their thoughts around, the troubles that they're having in terms of accessing the most up-to-date literature and how that sort of translates from knowledge to practice. And I think this sort of leans quite nicely with that critical disability lens as well, because it's all about accessibility. We do research to create meaningful impact within our communities, and when it becomes, there's a physical accessibility barrier, but also a technical accessibility barrier, because being able to critically appraise, relevant and applicable research takes time and skills to develop, and a lot of frontline staff don't necessarily have the time to sort of sift through what's an appropriate research question, what are the appropriate methodologies and the methods. For example, they just care about the, what do I need to know, and I need to know it right now. What are your five takeaways? And so being able to, I don't know, I'm going on a tangent here, I apologize. But it's just around, being able to access the relevant literature and then being able to sort of disseminate that in a meaningful and relevant way to the folks who need it. And that's what matters most, because I think, we need better evaluation metrics to measure the impact of our work beyond publication numbers and, citations. And so that's why I'm here. Yeah. Why do I care? I think I completed that. And so, yeah, so I'm very privileged to be partnering with Seedling Alberta on this venture through my PhD proposal. And, I just listed down the 4 pillars of what I believe community-based participatory research is. And that's predicated on collaboration. So, a shared leadership, neutrality, transparency, reciprocity, which is what my lovely panelist was already talking about, as well as the significance and the relevance of the research question. So ensuring that, right from the get-go, from the research question design phase, that they are part of that conversation, because we want to make sure that the research is meaningful and relevant to the folks who need it. Otherwise, what's the point? As well as control. So having, for example, a shared governance model and sort of within that in your framework as you're moving through the phases of the project. And then at the end of the day, it's about the return. So this is sort of what the panel is about, but creating knowledge mobilization activities that are accessible and meaningful, and not necessarily just through words, through short films, as for an example, or through infographics, or through just literally conversations, going out into the community and being able to talk and share about your work. Yeah, I think I'll stop there.
Well, I think one of the things that I love about your approach to your PhD, Caitlin, is that you actually did a directed studies course in the summer where you spent all of your time in the agency, and you sort of co-created a plan around data surveillance and what is ethical and what is appropriate when you're collecting data from people who have been, structurally marginalized by our mainstream systems. And you put the time in, right? You built that relationship, and so now, you have that sort of respected partnership with them, and Caitlin will be doing a full participatory action research project as part of her PhD. So she will be working with clients of the agency, she'll be working with the staff, and whatever comes of her PhD, aside from the benefits to you, the agency will get something back as well. So it's just a really excellent example of all the things we're talking about today. So thank you for that. And Gabe.
Hi. Like my exams in high school, I did not study, so I asked to go last, so I have notes now.
The best one is you're leaving together.
I was asked to talk about interaction with media as a researcher, under the assumption that I talk to the media after I publish things, but that has not been my experience. I don't consider myself a good enough researcher to have enough research to discuss with the media. I have 3 things I want to say, and I'll try to not ramble. I'm a general internist, so I practice medicine. I work at the Chateau Lockheed in the Northeast. I used to work in cups, and I work in porcelain, and I work at the Refuge Clinics. So I am a health services researcher, and I do public health research with Paul and a lot of great people in this room. It feels like every time I come back to the office, it's like a hub of human rights, which is nice. And so my interactions with the media were like minimal and terrible. I'm a born and raised nerd, did not have a girlfriend in high school. So I think my interactions with the media happened over time because of character flaws. 1, I'm Latin American, so I get angry and I'm emotionally labile, and 2, I have low impulse control. So I'll say things without really considering their true ramifications, and the media like that. And this is about as honestly, I've been thinking about it. This is what I've come to the conclusion of. It comes out of risk, I've learned. So, during the pandemic, due to my training, like humanitarian relief training and acute care training and in public health, I found myself like I just thrown into pandemic planning for the entire region in Alberta, and I was co-leading the design of the COVID units and the physician workforce, and we had no idea what was going on. And then after that, I with my partner, Dr. Emily Cope, we got pulled into the meat plants. At the time, they were the largest outbreaks in North America. Our health system, in my humble opinion, was not very adept at working with newcomers. Most of my research, sorry, I forgot to mention, is focused on socially vulnerable populations. So I did a lot of work in homelessness, and now most of my work is in refugee health, asylum, and migration health, domestically, but now increasingly abroad as well. And then after that, I, accidentally found myself writing policy, and then accidentally found myself inside meat plants doing the first occupational COVID vaccine clinics in the country. And then after that, fighting with our government the entire time, trying to get the Northeast and East Calgary, where I work, vaccinated. So I have that's my backstory. Here are the 3 points I learned in that entire 3 years. One, interaction with the media to translate science and medicine to the public is really important, especially in the age of misinformation and disinformation. It was really nice to hear that everyone lived under the, Renaissance, reductionist, Enlightenment assumption that data and knowledge is useful to make decisions. But I learned in the pandemic that was not the entire case. And so I went into research as a physician because I was really frustrated. Health equity is important to me. And so I was consistently frustrated. I knew that I could serve 30 lifetimes as a physician and not put a dent into the inequity that I saw every day at the hospital, or clinic or wherever. So I assumed that if I got a shiny research degree from a shiny university and would write papers with graphs that were very clear that said if we did this, it'd be cheaper, higher quality, and it was, would also pursue principles of health equity, things that were written in the Canadian Health Act in 1984, et cetera. I just assumed it would happen. And I'm like, I'm embarrassed to say that was the truth, but I actually just thought we would just hand it over to somebody. We publish it, we just hand it over, and then imagine. I learned naively that wasn't the case. And so when we get angry, because I find that I'm consistently advocating for people that don't have a voice. So I work in COVID. I designed the COVID units with a huge cohort. I worked in every single one of the waves, and I remember wave 2 and 3. Like, I can't even explain to you how many people I saw die. And I can't even explain to you in the alpha wave, like they all have names, but alpha beta wave, this part of the city was actually highest vaccination rates here and in my neighborhood in Southwest. Lowest vaccination rates, East Northeast Calgary. Highest per capita infection rates, hospitalization rates, mortality rates, East Northeast Calgary. And I was in the hospital when we ran out of ventilators, we ran out of oxygen, we ran out of chill solutions, we ran out of everything. We were putting entire families on ventilators. Every time a pregnant woman came in, I was terrified because I couldn't lie to her. Few of them were on ECMO here in the foothills or died within 48 hours. And our government didn't seem to care. So I started talking to journalists because they would be like, hey, what's going on? So I learned a few things. So one, it's fraught with difficulty because you will be misquoted. I would do these interviews under the, again, naive premise that people want to hear about science and public health and try to translate to the population. At the time was locked down. I thought that was something that we were obliged to do to counter Donald Trump and swallow bleach. And I would prepare for these interviews and I would study the latest research and I would show up and I would, they ask you and they're like, they need an interview in, I don't know, before 2 p.m. I learned that's the deadline. And then I would spend 8 minutes or 5 minutes talking about science. And then I thought the interview was over. And then I would say stuff like, oh, I hate Jason Kenney. And then that's what they would every time. So I learned in my low impulse control to have 3 things and just say those 3 things. And is there anything else you'd like to say? I feel like I would like to say, poor people's lives matter, et cetera, et cetera. So that's 1, you'll be misquoted, but it's important. 2, it actually is powerful, and there are good and trustworthy reporters that if you find them, like, talk to them. And so we spent weeks planning Cargill vaccine clinic. We've been the first in the country. We were ready to go. The day before, Chandro's office, our minister, canceled it. Inexplicably, we were just told it had to be postponed. And so we were also asked to consider our media, what we were going to say to the public. And we said, oh, we'll consider that very carefully. And at the meeting, like, called and emailed every journalist that we knew. We're like, would you like to hear about? And we went to the Globe and Mail and to like good journalists, and it blew. Anyhow, I do not make a lot of friends in power. However, it worked. Next thing you know, we were back on within a few days, and not just Cargill, but the policy rule, every meat plant, and then the oil fields in the north, et cetera, et cetera. Did not make a lot of friends, but it works. I learned how to chum the waters. So like I'd get on social media in the hospital, I'd be like, oh my God, 17th admission, people are dying. And then like, they're kind of like sharks in the water. They'd be like, I'd get ping, 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 ping. Tell us about that, tell us about that. And so then I would use it. And then I would say stuff like, I learned that you could just talk about whatever you want. I mean, Donald Trump does it. So I would be like, oh, tell us about masking in hospital. Be like, no, I'd like to tell, I would just be like, oh, that's really important. But can I tell you about the vaccine rates in the Northeast? And they'd be like, sure. And I would just say, I wouldn't even tell them. I'd be like, they do the interview. And I'd be like, the vaccination rates in the Northeast are abysmal. It's a crime, we let the children. So you can do that. And then the last thing I learned was when you continually get misquoted, I just started to write for myself because we write all the time. And so I thought if you can write a background section, if you can write a discussion section, I could write 800-word op-ed. And I wrote, I have a writing coach, Christina Frank, who's this she's a friend, but also this amazing, triple, quadruple award-winning journalist. So she taught me how to write for the public. It's really, really fast. You submit it, it'll get published within 48, 72 hours. You can direct your audience. I learned as much as, this is my second point, and I'm almost done. Second point is stories are way more powerful than data. So again, the assumption of a nerd was like Kaplan-Meier curves are really important, especially if they're in the New England Journal. And, I like graphs. No one cares. And so I started, Christina's words, no one cares. So I started actually just weaving, we have never ending supply of interactions in the community. I'm very, very, very deeply embedded in the community. And that's something I agree with everyone here. We have an immeasurable, unquantifiable number of stories. And so we would anonymize and mix them up and ask permission and make sure we protect people's privacy. But I would just tell stories and then weave, the principles behind it. I found that was a lot more impactful. And then the last thing, now I have a rule because I really liked it. It was fun. You could add some art and some philosophy. It was so much better than my method sections that are formatting references. And there's some really, really good places. So I learned the Conversation Canada. I mean, it's just for academics. And then, I got rejected at the Globe Mail 3 times, but I published in the Conversation Canada. Then it went to the Globe Mail. I was like, I don't understand this magic. There's healthy debate. There's really, and you could, decide commentary or you meet an editor and they'll gain trust with the editor, and then okay, and then the very last thing I'll say is community is everything, as everyone else said. I was inside meat plants. I was we were at union town halls. We were doing all this stuff with the community all the time, and so the voices that need to be amplified are Congress. And so now I just oh, would you like to do an interview? I'm like, yeah, sure. And then right before the interview, I'm like, oh, sorry, can I make it? And then I put up our community scholars or community leaders that we work with. And I'm like, oh, someone from my team would love to. And then I'm just like, oh, my master's student who has lived experience as a Syrian refugee, or that's my new move. So I'm like, yes, I'd love to. And then I just do it. And so I find that actually has a lot, their voices are so much more compelling. And so, I think the university, you can build a lot of trust from a university perspective if you're seen as a true community ally instead of, gobbling up airways to talk about our Kaplan-Meier curves if we just like get out of the way. I found that's also been really helpful. That's it.
Thank you, Gabe. I'm gonna say two things. First, your story is a perfect example of how we should be using media. I think lots of times when I go into an interview, I feel like I'm helping them by helping them tell their story. But I think you just absolutely exemplify the leverage and the opportunity that we have here, and that they should be a tool for us rather than the other way around. So that's fantastic. The other thing I would say to the group is, if you would like to hear a little bit more about Gabe's low impulse control, which I highly recommend, follow him on Twitter, which is now called
Oh, yeah.
X.
Don't.
Highly recommend. You will have an excellent day if you do that. So thank you very much to all of you. There's definitely some common threads that are coming through this conversation, and what I love about it is there's emotion and there's feeling and there's passion in today's conversation. So I really appreciate that. We are ready for some questions. So I have a couple, but I would much rather hear from folks in the audience. So is there anybody in the room or online that, yeah, you're nodding? Okay.
Yes, we have a couple. Could you back up? Aside from one's paper getting frequently cited by other researchers, how do you know if your ideas and recommendations are being practically implemented elsewhere for improving health outcomes? How do you know if the grassroots are using your information to inform their health decisions, especially if your beneficiary community has less formal literacy?
It's a big question. Who wants to tackle that one?
A thought. I think there are ways to, there's something called alt metrics that could be helpful for something like that. If it is a publication that you're tracking, we have access to this thing called Scopus, which is a large publication database through our University of Calgary library. And there's a plug-in to that PlumX that tracks like media mentions and policy citations. There's also like an Overton policy database. So there are places that you can look for that type of information. But I think that's one of those challenges of impact is you put something out into the world and you don't always know where it's gone. So it can require some searching on your part. One of the ways to kind of flip that is to talk to communities or to have those conversations or have those relationships to ask that question, like what would be useful to you and how would you like to see this? And I guess something I didn't mention, but should have, it was in my prepared notes. When you're thinking about research impact, you really should be thinking of at the level of the people impacted or that you are trying to benefit. So rather than just I put that paper out into the world, what are those sources that you can go to and say, did this make a difference? Like, did someone hear this? Has it been shared? Has it showed up in other, academic spaces? Has it showed up in policy? Can I find some of that evidence to support my telling the story that, yeah, I published this really important paper. How do we know? Who cares, right? Yeah.
Can I also, just adding on to that, I think from a frontline service provider perspective, there's no way. I think that to your point, I think creating authentic community relationships goes a really long way. And so being able to say, I just put out, being able to contact or follow up with whoever you think should be the knowledge, the end knowledge user, I think just, following up or putting that out on social media would be a really great way to get, folks using your knowledge. But I also know that at least from the harm reduction world, we know who to follow. And there's a lot of different communities of practice that are out there. So I really encourage folks to sort of be in contact with different communities of practice to be able to share that knowledge, because there is a lot of eagerness and uptake, eagerness to sort of follow through. And, there are keeners out there who are willing to use that folks research.
I think another idea might be like the diversity of the people who engage with your idea, to be able to think about that. So in the rural space, certainly we've had the experience of people who say, I don't agree with you on much, academic guy, but I agree I need doctors in the community. And so I'm willing to work with you as an analyst. And Gabe talked a lot about kind of the fracturing of the world into people who are polarized and don't actively disidentify maybe with academia and with knowledge, but But sometimes having people who maybe live in that space where they say like, I don't trust people or academics, but I can engage with this particular idea because my story is part of this story, I think is a way of thinking about what impact, hard to measure way of thinking about impact.
For me, I think it's a lot more practical. So when we designed the, physician workforce plan, we had a team of like 35 doctors. We put together 2 weeks. We published it, and the way we know that it worked or that it was useful was that we used it almost entirely intact throughout the entire pandemic, and that plan was, delivered through AHS to Edmonton, and then it was sent out to other jurisdictions that basically that used it. And so that felt good to know that we did a thing that helped others. The second, we were politely asked to leave vaccination after we did the first mass open, community-led, community-derived, community everything vaccine clinic in the Northeast. And by November of 2020, the first dose vaccine uptake in upper Northeast was 99.6% for everyone above 12, 96% in East Calgary, or in lower Northeast Calgary, and then 94% in East Calgary. Those are the highest rates in North America in a large metropolitan center with the highest racialized community and lowest income. Like East Calgary is our lowest income community in the entire province. So again, I think we published on it, but the things we published are pale in comparison to the actual, to me, the practical outcome of, that we did our best, as best we could to operationalize that knowledge. And I think the only other example I have, which is, Annalie and I will never supersede, is we, a single case at a refugee clinic, long story, but eventually we ended up fixing the water supply at 3 refugee camps, Kakuma in Northeast Kenya. Water supply was toxic with fluoride. We did this long investigation, truly like bedside to bench. And then we worked with the UN and WASH, published like 1,000 words in the Lancet, but who cares, because 300,000 people I will never meet have fresh water. I just got an update today from Kakuma on their 15th well. And they've expanded that drilling process into the alluvial sands, not into the volcanic rock where the fluoride is toxic, fluoride levels are toxic. That sort of stuff to me speaks a lot louder than publications. And so it could be after the fact, right? You do the thing, build the project, build the program, do it with the community. And then after the fact, I feel like part of our job is scientific reporters. We write it down, we legitimize it with a publication, even if you don't care, that publication has weight. And it honestly, I'm telling everyone all my secrets, but it gets me into a room with a bunch of policy people because I wrote a paper, a totally descriptive piece of garbage, but so I won't say that. It's not an RCT in my world, right? RCT is rule, but it's a paper, but it only takes one and suddenly you're the expert on meat plants and COVID. And now you're in a room with people. We were in a room with like 3 levels of government, Canadian Food Inspecting Agency, the union, the employers, the social agencies, the employees, everybody in a room. And they were all like, okay, doctors, what should we do? And then Annalie and I are like, you should vaccinate the meat plants and then you make a scientific argument, food security for the country, economic impact to the province, like the health equity, you overrun the health system, you just make, and so it is, I think that's what I've learned is you can use the science after you build the thing, and then you use it to get you into the room, and then you can build these, exactly as Aaron was saying, is you build these coalitions where people are pretty practical. And when there are lots of things in our world in health that most Canadians, I still have a lot of hope that most Canadians agree that having a healthy population is a useful thing.
This is why you write your speaking notes when you get to the event where you're presenting.
No, there's another perfect example of like low impulse control. This is when I should just shut up.
Thanks, everybody. Those are great examples. Is there a question in the room? Yeah.
For Stephanie, you talked about matchmaking with faculty members. Can you tell us some examples Are there community members looking to connect with faculty? Does it work?
It does work both ways, yeah. So we will take requests for, oftentimes it's just a question that comes up like, hey, I've heard your team does this, like someone will book a consult or have a question. Sometimes it leads to support on knowledge mobilization plans. Sometimes it leads to a partnership discussion. Sometimes it comes in directly as a partnership discussion. So yeah, we have lots of members of the community from kind of larger organizations. Some folks already have relationships built up, but they might be looking to kind of broaden. Others are engaging with the university for the first time and they're like, hey, we want to do some research and we don't really know where to start. And we're one of many right doors for engaging with the university. I mean, I feel like I'm always asked for specific examples and I always think of the like, what not to do in partnership examples. So maybe I'll glean from the what not to do in partnership examples and say like coming in with an idea that is well-formed enough that we can look for potential matches is really key. Having some idea of what you'd like to do, but in a perfect situation, not having it so nailed down that there's no room for movement makes for a really good partnership because there's enough room to be kind of co-creative. In intake, we'll often ask folks, are you ready to actually work with a partner? Are you ready to like, how ready are you to share the design of the project or the development of ideas or the conduct of the project? So kind of getting a sense of that like openness to collaboration. What's your timeline? All those types of different questions of like, what are you hoping to get out of this and when? And then we take that back and we do some internal searching of whether it's a community member looking for a researcher, we'll use a couple of different sources to say, who do we know? Who do other people know? What's available online? Please update your UCalgary profiles. It makes our lives so much easier. But sometimes it's about finding what's more emergent and asking around. And then we'll start putting out feelers to those folks to see if they are interested in a partnership. And then eventually, if that all works out, then we facilitate an introduction. So we do a lot of the legwork for finding and connecting partners and assessing that readiness. Yeah. Thanks, Stephanie. Other questions? Someone online?
Yep. Is it unethical to later advocate for or mobilize an intervention for your study community? Example, provision of emergency medical services for hard to reach communities if the study was originally not designed as an interventionary study?
That's a tough question.
I could take that one.
Yeah.
I would say, one of the things that I've learned from mentors that have been advocates for a very long time is it is absolutely, the bar for us is much higher on truth and how we interpret science. And so under no circumstance can we over extrapolate or exaggerate the data in what I've been taught, because it'll come back and haunt you and you could actually end up doing more damage. You know, media, I don't know what they're called, but let's say the war rooms of political parties that have agendas, they have long memories, and if you're written and it was inaccurate, it'll come back. So I think, and it will further degrade trust, I think in science and in public health after the pandemic. So for us, I think I've been in that situation. We have one of a great program we built at CUPS in homelessness, and it wasn't randomized. And so we say the things that we know, and then we do the caveats around what we don't know and that it wasn't randomized. And then you can also talk around, like, as scientists, I think we can be a little bit more confident around what we do know and say, without making it seem like we know nothing, so we could say this study showed these things, while it wasn't definitive literature from around the world also shows that if you house people, treat them with dignity, it'll cost you less money or whatever. Anyhow, that would be my, that's a hard rule. I think is that you can't over extrapolate or exaggerate science.
Other questions? Yeah, go ahead.
Or but I quite a bit. I think it's a question for Stephanie. It's kind of dovetailing what you just said. asking. So one of the things that we're seeing in equity in precision medicine, or here, is a desire, like it's another layer of connection between the training and impact. When we published a paper about what we're doing in this area, one of the reviewers said, you know, if we talk about training, that's a big part. It's going on in your space. So I was wondering if you see, and it's actually a question of young people, that you also see young people that are coming from the community who are interested in joining the group. And it's a facet for training, again, another layer of connection to community.
It's a really great question, a really great consideration, and I think it plays into that idea of reciprocity and mutual benefit as well, is having those open conversations about what, as researchers, sometimes we partner with community because, you know, it's access to a population and it's like data, and the data is better that way. Why does community partner with us? What are they hoping to get out of that? What's in it for them? So I think that there has to be that open discussion about that. I know some partnerships really do emphasize community capacity building and, you know, research literacy and involvement in research, exposure to the university or post-secondary environment, can all be really valuable. But I think that's a question to ask in those partnerships is, you know, what, in a perfect world, what would you like to get from this, or what would you like to be on the table? And thinking more broadly about what that partnership could look like. Sometimes there are people that, go in and do like a workshop series with folks within an organization, to give back a bit and build that capacity. So we see it sometimes, but not always. We don't often see, personally, our team, we don't deal as much with students. We're more faculty and organization facing. Knowing that, you know, it's often students doing the bulk of the work. So, and organizations sometimes reach out to us because they're looking for access to students as well. So we're kind of like in an in-between space, I would say there. I think that's a great lens to bring to it, and to think creatively about what would be helpful and useful. And is there something that you could design or develop? But there isn't like an across the board, this is absolutely needs to be included in every partnership, but asking what would be equitable, what would be ethical, what would be beneficial to all parties is really what makes a strong partnership, is agreeing on that and everyone kind of getting something out of it. So great question. Yeah.
That's, I'd just like to follow up on that. I've been deeply involved in communities and marginalized communities for a long time. And I finally decided we needed a science of engaging people, especially in health and innovation. And that book is now published, but it's been a struggle to find a way to reach out to the health researchers, because most health researchers read the literature in their condition or in their domain. And this is not about that. It cuts across.
Yeah.
And I've been really excited by what's happening in other places. You know, I'm just on my way to the inaugural citizen science and health.
Where are you going to
And yeah,
Wonderful.
and it's exciting that I think in Calgary and in Alberta, we've been real leaders in engaging patients in research and in training patients to become researchers. And it's fascinating to see that in those countries that have things like citizen science and open innovation and science, Ashoka, and all of those amazing university networks that are not here, which and that really it seems a disconnect. But where citizen science as a whole, like in Europe, there's citizen science policy at the government level, that you don't do research without having patients directly involved. So I'm going to sort of push them to look at what we've been doing, but I don't know how to reach out in Canada and to a similar body, like we don't have, I mean, citizen science in Canada really is about environmental and natural kinds of things. We don't have a body that's doing that. But in other countries that's there. And I just wondered if you had any ideas in terms of how to use the strength that we do have and the expertise to bring some of that expertise there, but also to really activate our university to be more than just interested in open innovation in science or in citizen science, but to really get on board. You know?
We should exchange contact info as we get into this open science strategy business. Yeah, I think that's, and I would love to hear from others as well, because I feel like I'm kind of taking over, but you raise really good questions, and we also don't have like a central research impact network here, but we do have a number of interconnected networks that work in this space. So there's, you know, Community-Based Research Canada is a national network. The University of Calgary is a member of that. There's Research Impact Canada. The University of Calgary is a member of that. There's Community Campus Engage Canada. There's the, you know, science policy conferences that happen. So there's all these different spaces that are working in this, but really what it's lacking is coordination and like a central coordination point. So I think that's, and same with the University of Calgary and Alberta, there's a lot of really great community engaged, community-based, you know, patient-oriented research happening. How do we raise the profile of that and make that kind of the norm and the expectation? So I think some of it is like telling those stories, going to those spaces, and then also finding a venue to come back and share that with the University of Calgary, for example, and say, here's what we learned, here's what we heard. What's a space that we can share that in? Because we share that goal.
Yeah.
Yeah.
And I think one of the reasons that, like if you're going to be doing innovative kind of communicating with communities and with professionals, you have to talk their language.
Yeah.
And the language of engagement is not an easy language for people who are steeped in academic language. And so, I mean, so you're really always struggling. It's not just that communities don't understand us, but often we don't know how to understand them. And so when you have to take it down to plain English or not talking like a journalist, which is how the book got written eventually. It was written in a journalistic style so that everybody could read it. But, you know, and it's a real struggle with how to break through that ceiling. And I think, you know, you've had experience in that area already, so.
I was gonna say, turn it into stories, like.
Yeah.
We put our community scholars through the PACER program. They're
Yeah.
all like the most incredible community leaders. Like those people, we were asked to do a podcast, and I was like, yoink, and put all four of them. And so that went internationally on a podcast called Healthcare for Humans, and it like highlighted. So I think it's in the storytelling, and I think the policy, because politicians are funny things, but I think there's two things. One is the de facto policy can just be set, like, we no longer do any research. It's not community involved, whatever. That's just an internal.
And that's happening.
Sure. I mean, a lot of groups are doing that, but if you want to get to the next policy level, the politicians are going to chase the votes and the stories that are out there. And so I think if you get I grew up in rural Alberta, there's a lot of good people out there. There's great stories all over the place. So us as scientists, engaging with community members and communities to tell their own stories, and those stories are really compelling. That's how policy will chase it after.
Yeah, but it's encouraging academics to buy into that.
Well, and creating the support so that.
That's a long time to learn that light was neither a particle or a wave. Like,
That's
it's
right.
science. There's lots of.
I know we've got one more question that people, you've been trying to encourage me to give you space. So one more question, so please go ahead.
Perhaps not so much a question, but a reflection on what people said. Coming from my engagement with the press at various times, I get the feeling that there's a change now, that there's less space available in the newspapers and the TV news and so on. And so we have to be strategic about thinking what the writers need. That a lot of the time, if we write the story that we want them, they will just transfer it and put it in because they're in a hurry. They don't have the time to think hard. So if we've done all the thinking, they will take it. That's where the conversation comes in. The other issue is urgency. That if they've got the Gaza war, there's no space for anything about health at the moment. We have a most amazing story, it still won't get in because their space is filled. The energy is taken up. So we have to recognize that we're often second phase. And that's where the conversation comes in, because the story that you tried to get in, they wouldn't accept because, hey, they were overloaded that day. But you write it next week. Oh, how are we going to fill our space? And we've got the conversation. Yeah, that'll do a good story. So it's a matter of being strategic about how to get in at times when they're not overwhelmed by something else.
That's true. I totally agree with you, but I'd also just say that I think when we're talking about that news media, we're talking about a particular audience. Yeah. So if we're talking about people who are less than 30 years old, most of them never pick up a newspaper. Most of them use news aggregators if they use them at all. That's not how they get their news. And so one of the things that I think is important in that space is to say, if we can't get our story out to that audience, maybe we can get it to a different audience who can carry the story and see the audience as an ally, right? So if you can use social media or use other methods to get your story to a younger audience and have that message resonate with them, they can help carry your story in a way as well. So I agree. I think that there is less space and there's consolidation of news media, and there's like 2 companies that own every rural paper in Alberta, and it's a problem. But I think part of that is we have to adapt as well, right? Like I like to read the newspaper, but if I want to connect with someone who's not in the same generation as me, I have to be willing to step in my comfort zone and tell my story.
I think, sorry, we're over time, which is fantastic because this has been a very engaging conversation. And I think the thing that I've been thinking about through all of these conversations is that it is about stepping outside of our own comfort zone and stepping outside of the ways that academics we've been trained to be in our disciplines and in our expert models. And I think the 4 of you have just, brought up some really, really important questions about how we can have really great impact, but it often falls on us to do that, right? And so one of the things I'd like us to think about maybe in the next conversation is how well is our university supporting us to do this kind of work, and is there ways that we can be better in that? Because I think when you talk about the impact that all of you are having, it's phenomenal. Like it's inspiring and it's exciting and it's interesting, and that's the gift that I think we have if we leverage it and we do it properly. So massive thanks to all 4 of you and for your great questions. Thank you, everybody.